On April 14, around 6:20 in the morning, New York police officers shot and killed 60-year-old Queens resident King Wong. Police had been called after reports that Wong was showing signs of mental distress while holding a knife near 30th Avenue and 31st Street in Astoria. When officers arrived, they attempted less than a minute of de-escalation before opening fire. They later claimed that their tasers were ineffective and that they were forced to defend themselves. Eyewitnesses, however, say something different. One witness explained that as soon as the police shouted for Wong to put the weapon down, shots were fired almost instantly. Another eyewitness who recorded the incident said Wong looked like he was walking away when the officers began shooting. Video footage shared in the news supports these accounts, showing police chasing Wong with their weapons drawn just seconds before they killed him. According to neighbors, Wong had struggled with mental illness for years and had been cared for by his parents until they passed away. His death is not an isolated case. It is part of a larger pattern of police violence against people experiencing mental health crises. In 2024, 19-year-old Win Rozario was shot and killed by police inside his own home in Queens. He was holding a pair of scissors. His family begged officers not to shoot, but within minutes he was dead. Back in 2018, Saheed Vassell, a well-known man in Crown Heights, was killed while holding a metal pipe. His family has said if he were white, police would not have opened fire. Since 2015, the NYPD has killed at least 20 people in mental health crises. Nationally, over 1,400 people with mental illness have been killed by police in that same time. Experts say people in crisis need medical and community support, not armed officers. The U.S. Department of Justice has stated that under the Americans with Disabilities Act, people in mental health crises should receive the same standard of emergency health care as anyone else. But instead, they are often met with excessive and even lethal force. New York City has tried to create alternatives, like the Be Heard program, a team of health professionals who respond to certain 911 calls. But the program only covers part of the city and does not respond to situations considered threatening. Even if expanded citywide, it would employ only a few hundred staff compared to the NYPD's 35,000 officers. Meanwhile, the police budget continues to grow, while funding for housing, psychiatric care, child care, and other social services is cut back. The killing of King Wong shows us once again how broken this system is. Instead of care, vulnerable people are being met with bullets. Until more resources are directed toward health care and community support rather than policing, tragedies like this will continue. This is Blue Cam Info.